We always knew there was going to be an uptick in cases as we started to reopen the country, so we shouldn't be surprised that we're seeing that. You really have to look at hospitalizations, not new cases, because cases are going to go up in part because we're testing a lot more right now. The positivity rate nationally is actually coming down. Fewer of the cases that we're testing are actually positive, but you do see hospitalizations going up. That's really what we should be focused on. That's a lagging indicator, so you're just starting to see them go up right now in states like Georgia and Florida, Alabama, Virginia, Wisconsin, Minnesota, Ohio. So some of the early reopened states, you are seeing hospitalizations tick up. Again, we expected that, and this is in part why we prescribed a very staged reopening, where you do it in phases and you wait a little bit of time to see how much of an uptick in cases that you're seeing as a consequence of the relaxation of the social distancing requirements. And so this was expected. I think one of the questions now is going to be, will we do this in a gradual enough fashion? And also, will there be a strong seasonal effect? So we'll be reopening against the backdrop of summer, which should be somewhat of a backstop on spread.
Dr. Gottlieb, we also heard from the president yesterday that even if there's a second wave or a second spike in cases later this year, that he doesn't plan to re-shut down the economy. I mean, presumably if there was a crazily big second wave, that view would change. But that aside, do you kind of agree with that point of view?
I agree that what we should have in place is a really good screening system heading into the fall when we're likely to see that second wave, so that we can identify where the spread is and take local action. You don't want to be in a position where there's an epidemic in multiple cities. You don't know really where it's spreading, and so you have to simultaneously shut down the entire country, which is basically what we had to do on the first wave. When we do have cases in the fall, there's probably going to be outbreaks in select regions, select cities. There might be epidemics in cities or states. You want to be able to target the action in those parts of the country and not do something simultaneously across the entire nation.
The CDC this week and the FDA previously had changed guidance around surfaces and how easily transmissible this COVID-19 is happening. And the upshot is, according to the CDC, the virus is thought to spread mainly from person to person, not spreading easily in other ways from touching surfaces or objects. So, Dr. Gottlieb, can we stop wiping down our groceries?
I'm not sure it was such a change in the CDC recommendations. They based it on epidemiological data that shows that most of the outbreaks have been from respiratory spread from people who've been in close contact with each other. We've always known that most of the spread here is really from direct contact with people and sustained contact with people. That's why people who work in a sustained fashion, like in meat processing plants and in grocery stores, are at risk because they're working without protective equipment with other people for long periods of time. And so those are risky settings. They're at-risk settings. But that doesn't exclude the possibility that there's some spread from contaminated shared surfaces, and there is. We just don't know what component. So it still makes sense to clean shared surfaces. Things like subways end up being sources of potential spread. So I think cities implementing cleanings, airlines doing that, others where you have a lot of people trafficking through sites where there's shared surfaces, it's very prudent to clean those. Whether or not you need to wipe down your groceries as aggressive as some people have been, that's another question. I think there's much less risk from, your daily life touching things like that.
Do you do
but
it?
Washing your hands, cleaning shared surfaces, I do it within reason. I'm careful with my hand hygiene definitely when I go out now, and I have been for some time. I'm wearing a mask when I go out. I think everyone taking simple precautions in their daily lives, trying to limit activity where they can, being careful about their hygiene is going to have a big impact when you sort of distribute that over the population. And there was that study out of CHOP that sort of identified that. If everyone just cuts down their activity a little bit, that can have a big impact. But the CDC really didn't change their guidance. They're just saying more of the epidemiological data is tipping in the direction of showing that the spread, when you look at the clusters of infection, is from respiratory droplets and from groups of people that have been together for long periods of time.
Dr. Gottlieb, earlier this week, we got the news from Moderna about their vaccine, and some people since then have criticized a lack of hard data released, and it was more just pointing to news rather than hard data. Dr. Fauci, in the last 24 hours, been a bit more positive, perhaps, than some of the analysts have been. Where do you stand on that? Has he seen more of the data to lead to that positive view he has, or is it just that what has been released he welcomes more than perhaps some of the critics?
Well, I don't know what Tony's seen, but it's hard data. It's just early data. It's 45 patients. All the patients developed antibodies to the virus, and in 8 of the patients, they were what we call neutralizing antibodies. They not only bound the virus, but they destroyed the virus. The other 37 patients, we don't know yet whether they developed neutralizing antibodies, in part just because they weren't tested yet. NIAID, the NIH, Tony's group, does that testing. They have to do it in a BSL-3 lab, a secure lab, because they're exposing the blood to the virus. So it has to be done in a secure setting. They're going through and doing that now, and we should have that data out soon. But I think most people presume that if it produced neutralizing antibodies in the first 8 patients, it probably produced it in some complement of all the additional patients. So it's encouraging. What it suggests is that this is a virus that we should be able to develop a vaccine against, whether it's going to be Moderna or another company. The company I'm on a board of is involved in developing a vaccine as well. It's not clear which vaccine is going to be first to market, and hopefully more than one gets to the market in a reasonable time frame. But it looks like we'll be able to develop a vaccine against this virus. And I think that's what's encouraging. This seems like a druggable target based on all the data we're seeing, the Oxford data, the data out of China, the Moderna data, and some of the other animal studies that we've seen.